This medication is used to prevent or treat low blood calcium levels in people who do not get enough calcium from their diets. It may also be used to treat conditions caused by low calcium levels such as bone loss, weak bones, decreased activity of the parathyroid gland, and a certain muscle disease. It is also used to make sure certain patients are getting enough calcium, including women who are pregnant, nursing, or postmenopausal, and people taking certain medications. Calcium plays a very important role in the body. It is necessary for normal functioning of nerves, cells, muscle, and bone. If there is not enough calcium in the blood, then the body will take calcium from bones, thereby weakening bones. Vitamin D helps your body absorb calcium and phosphorus. Having the right amounts of vitamin D, calcium, and phosphorus is important for building and keeping strong bones. The recommended daily dosage for calcium 600+D plus minerals is typically 1 to 2 tablets a day, taken with a meal. It is best to take this medication at the same times each day to help remember. And it is important to follow the directions on the product label and consult your doctor for specific dosing instructions. It is best to take this medication at the optimal timing in order to maximize its benefits. The best time to take calcium 600+D plus minerals is typically with meals or immediately after eating, as the presence of food in the stomach can increase the absorption of calcium and vitamin D. Remember to consult your doctor or pharmacist for any specific concerns or questions about taking this medication. When taking calcium 600+D plus minerals, be sure to take it with food. If your product contains calcium citrate, you can take it with or without food. Be sure to follow the directions on the product package or as directed by your doctor. For best absorption, if your total daily dose is more than 600 mg, divide your dose and space it throughout the day. If you have any questions, ask your doctor or pharmacist. If you are using the liquid form of this medication, carefully measure the dose using a special measuring device/spoon. Do not use a household spoon because you may not get the correct dose. If you are taking the chewable form, be sure to chew thoroughly before swallowing. If you are taking capsules, swallow each capsule whole. Do not crush or chew extended-release tablets. Doing so can release all of the drug at once, increasing the risk of side effects. Swallow the whole tablet without crushing or chewing. It is important to use this medication regularly to get the most benefit from it. To help you remember, take it at the same times each day. If your doctor has recommended that you follow a special diet, it is very important to follow the diet to get the most benefit from this medication and to prevent serious side effects. Do not take other supplements/vitamins unless ordered by your doctor. Calcium supplements come in different forms that contain different amounts of calcium/vitamin D. Ask your doctor or pharmacist to help select the best product for you. If you think you may have a serious medical problem, get medical help right away. If you experience constipation or stomach upset, it's important to consult your doctor or pharmacist right away. Your doctor has determined that the benefits of this medication outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, it's important to notify your doctor if you experience symptoms such as nausea, vomiting, loss of appetite, unusual weight loss, changes in mental/mood, signs of kidney problems, bone/muscle pain, headache, increased thirst, increased urination, weakness, tiredness, or fast/pounding heartbeat. While a serious allergic reaction is rare, seek medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. Before taking calcium 600+D plus minerals, it's important to let your doctor or pharmacist know if you have any allergies to it or other vitamin D products. This product may contain inactive ingredients that could cause allergic reactions, so it's best to talk to your pharmacist for more details. Additionally, before using this medication, make sure to inform your doctor or pharmacist about your medical history, especially if you have high calcium/vitamin D levels, difficulty absorbing nutrition from food, heart/blood vessel disease, kidney disease, certain immune system disorders, liver disease, certain bowel diseases, or low levels of bile. If you are diabetic or have phenylketonuria, caution is advised as chewable tablets may contain sugar or aspartame. If you are pregnant, it's important to discuss the risks and benefits with your doctor before using this medication, as doses of vitamin D greater than the recommended dietary allowance should only be used when clearly needed. And if you are breastfeeding, consult your doctor before using this medication. It's important to be aware of potential interactions with other medications. Calcium can decrease the absorption of certain antibiotics, bisphosphonates, and other medications. It's best to separate your doses of these medications as far as possible from your doses of calcium and vitamin D. Also, be cautious when using other products that contain calcium, phosphate, or vitamin D, such as antacids, laxatives, and vitamins. Lastly, be sure to inform your lab personnel and doctors if you are using this product, as it may interfere with certain lab tests, causing false results. If you suspect an overdose and the person is experiencing serious symptoms such as passing out or trouble breathing, it is crucial to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call the local poison control center at 1-800-222-1222. For Canadian residents, reach out to a provincial poison control center. Symptoms of overdose may include nausea/vomiting, loss of appetite, mental/mood changes, headache, drowsiness, weakness, and tiredness. It's important to have regular medical and lab tests to monitor your calcium levels while taking calcium 600+D+ minerals. Make sure to keep all your appointments and consult your doctor for more information. You can get vitamin D from foods like fortified dairy products, eggs, sardines, cod liver oil, chicken livers, and fatty fish. Your body also makes vitamin D when you're in the sun. Calcium-rich foods include dairy products like milk, yogurt, cheese, and ice cream, as well as dark green leafy vegetables like broccoli, spinach, and bok choy. You can also find calcium in fortified foods like orange juice. To reduce your risk of bone disease, try to be physically active, avoid smoking, and limit your alcohol and caffeine intake. And don't forget to take your daily dose of calcium 600+D+ minerals at the best time for you. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take double the dose to make up for the missed one. When it comes to storing your calcium 600+D+ minerals, make sure to keep it at room temperature and away from light and moisture. It's important to store it outside of the bathroom and away from children and pets. When it comes to getting rid of any unused or expired product, make sure to consult your pharmacist or local waste disposal company for proper disposal methods. Avoid flushing it down the toilet or pouring it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.